Hello from gorgeous Naples, Florida. I'm Tony.
And I'm Leona.
And welcome to Tony and Leona Live. We certainly appreciate everybody who's joining us and who will be joining us. Also, thank you to all the people who have subscribed to our channel and liked our videos. We can't explain how much that helps just build the audience. This is our third live stream. We plan to live stream multiple times every week. We're not quite getting into a schedule yet. This is our first set, but all those people who are with us right now at the very beginning, we can't tell you how grateful that we are because
Absolutely.
We want to grow this show big. We want to grow our audience. We want to love our audience and serve people by giving them facts. And so this next year, we really plan to do it a lot. And we're going to expand our studio. We're building our room over there. We're going to have a green screen and
right in our
bunch
bedroom.
of other things. So, but today's show, we're going to do our first fact-checking segment, and we're going to fact check the claim that COVID-19 is the 6th leading cause of death for children ages 5 to 11. This claim has been given by the CDC. It's been used by others. This is relevant because today OSHA finally announced the much waited for regulations for employers of 100 employees or more. They're going to have to start doing the mandates or the vaccine mandate rollout. If they don't, they're going to face penalties of $14,000. And I think if you're willfully violating this mandate, I think it's even higher. I think it's $100,000 or something for that.
Yeah.
Also, it's
Hi, Amy. Hi, John.
Hey, guys. Thanks for joining us. But yeah, so many of you know, just a few disclaimers is neither of us are scientists. We're not giving anyone any medical advice. We're not telling people to get the Pfizer, to not get the Pfizer. We just simply want to present facts that we've done from our research. Leona does have a background in nursing. You currently hold how many licenses?
I have a nursing license in Minnesota and in New York.
So in Minnesota, you were mainly a peds ICU nurse for how many years?
For 5 years. And then for 2 years, I was in a peds pulmonary specialty clinic. And then I was home with the kids for a little bit.
With your dream, home with the kids. And all of a sudden, the first signs, if you remember, like back in, I think it was January, maybe even December of 2020, when those videos started to come out of Wuhan, China. And there was that doctor who made worldwide news when he was warning the world for the first time about a mysterious a respiratory outbreak in China that was infecting many patients and killing a lot of people. And he warned the world, and he actually later died warning the world from COVID. And I'll never forget this time, Leona and I, we kind of had a perfect storm. My truck died because of the shutdown. I lost 3 deals. We had some customers that owed me money, and the shutdown hit. And the truck was really the big one. But I'll never forget when we were sitting on the couch together, we were watching the news, and Governor Andrew Cuomo, disgraced governor now, he went on and he was pleading desperately for anyone who had emergency room experience, physicians, ICU nurses, to come to New York City. And Leona and I looked at each other, and it was almost like we were talking to each other in a subtle way. We didn't say it directly, but I could tell in Leona's eyes that it wasn't something you were exactly excited to do, but it's something that she felt called to do in a way because she had all those skills to do that. And I liken the first responders during that time, the nurses, the doctors, the ER doctors, the hospital staff, even the sanitation crews, the police officers, the ambulance drivers, all those people who were working face to face with the public in those earliest days of the pandemic. I liken them to the heroes of September 11th, the first responders of that day who ran into the building to save lives without thinking twice, because we didn't know much about COVID-19 back then, or the coronavirus and exactly what it did. We knew some of the things, like the specific demographics, but there was a lot that we didn't know, and there's still a lot that we don't know. And
hi, Monica, I'm glad you're here.
So that's just why we wanted to stress neither of us are offering medical advice. Leona has a history of working with COVID patients in ICUs in California, in Florida, in New York City. She's also an ICU nurse. But we just wanted to strictly go over the facts here.
Yeah, so none of that, while I'm grateful for the experiences I've had, none of them make me an immunologist or virologist or epidemiologist. So yeah, not here to give medical advice. One thing I am grateful for, I went to nursing school at the University of Minnesota, and they were very, very focused on research in all areas. In fact, I complained about it at the time because I wanted more hands-on experience, which I felt like we didn't get a lot of. Hi, Alvina. Glad you're here. But we certainly wrote a lot of research papers and learned how to read science journals and how to find credible sources and how to interpret the data and write papers on that. So that has been helpful.
So yeah, today, but when I was, I've been trying to get my real estate license here in Florida. It's probably going to take me another week or two of taking these online classes, but I was sitting at the library doing these classes, and I streamed the congressional hearings today with Dr. Anthony Fauci, who's the chief medical advisor for the White House. He's head of, I forget the name of his institution exactly. Is he head of the NIH? And then Dr. Rochelle Walensky, she also was testifying at the same time. So they were taking questions from the U.S. Senate.
And she's the medical director of the CDC.
Yep. And I was struck by U.S. Senator Cassidy, and I'm not quite sure what state he was from, but he had questions for Dr. Walensky, and he asked her, he said, how many of the employees at the CDC are vaccinated right now? And she kind of gave the canned answer. He pushed the issue more. He asked her how many are vaccinated, and she couldn't give the answer. She said she didn't have it off of the top of her head. And I know that they've been asked this question before, whether or not she was the head of the CDC at that point. But I just found it telling because on the day where these mandates are taking place, where they're asking private sector employers, restaurants, and corporations to enforce these mandates on their employees, the government isn't doing the same thing. And so Senator Cassidy's point was a good one. He's like, how, if you're trying to build faith with the public in these, in the Pfizer, then shouldn't your employees at the CDC, the workers there, be front and center? And she didn't really have an answer for that. So, but yeah, that's why, these are trying times to get facts, to get information, to try to sift through what's true and untrue and what's spin and what's propaganda. It's becoming increasingly challenging and difficult. So that's part of our goal with our live stream here, is to just help sort through some of the facts, some of the fiction.
And of course, we realize we have biases like everyone else. We have different risks than other people. We have, I think in some ways, I think like just data is sort of a false hope, because everybody's going to choose to look at different data and interpret data differently. And I think a lot of that is fine. I think that's part of why bodily autonomy is essential. I think that's why the ability to see the healthcare provider that you choose is essential. So I think we can respect each other in that and recognize that that's part of being human. But I also think it's important for all of us to look at actual data and not just headlines and
or just or emotions or fear, to sift through that all. And one last point I wanted to bring back about the parallels to the first responders during September 11th is, if you followed what those responders did afterwards, many of those first responders at the September 11th site, they got respiratory illnesses. Many died. I think they got cancer. They got lung cancer. They were breathing in all that dirt and soot and ash. It was burning for literally months. And but one theme, and maybe this is a problem that we have with our culture or society, but a lot of people forgot about those first responders. They got thrown under the bus. They got a lot of benefits stripped from them. Like I said, many of them lost their lives. They had astronomical healthcare costs, and we kind of forgot about them. And it's similar to what we're seeing now with those people who initially put their lives on the line, who continued to work, those essential workers, the healthcare workers, the first responders. Many of them now are either walking away from their jobs, or losing their jobs, or they're getting fired, or they're getting demonized, or they're getting called crazy. simply for just
Or they're placed on
raising
unpaid
questions.
leave. Yeah.
And I think as a culture and as a society, we need to do better in terms of how we treat our heroes. And so that's why, I know Leona's got incredible friends and family and people who have supported her. And
Absolutely.
entirely grateful for you all. So that being said, let's get into our topic at hand. So again, what was the claim again?
So the Kaiser Family Health Foundation analysis of death data, they said that COVID is the 6th leading cause of death in children ages 5 to 14. When I read more into it, they said that it's the 6th leading cause, or it was in January, August, and September. Since then, it has decreased where it is. So overall, it has been the 6th to the 13th leading cause of death. And then I went to the CDC. Well, I've looked at the CDC a lot over the last several months, but today looked again. So the CDC death data report, they have data compiled by the National Center for Health Statistics. And according to them, COVID is currently tied for the 8th cause of death for children. So number 1 is accidents, including motor vehicle and drowning. Number 2 is malignant neoplasms, which is cancerous tumors. Number 3 is congenital malformations and chromosomal abnormalities. Number 4 is homicide. Number 5 is heart disease. Number 6 is chronic lower respiratory diseases. Number 7 is influenza. Number 8 is tied between suicide and COVID. So,
and those top 4 causes of death, because we looked at some of the historical data, and it's pretty similar. It hasn't changed a whole lot.
Yeah,
if you go
motor vehicle accidents, drowning, neoplasms.
Accidents are a big one. Drowning is a big one. But if you go back to the 1900s, so the turn of the century, the 1900 time, that's when viruses were more deadly. That's when they tended to kill. That was the number 1 killer. And just to give some context, I looked at the last 10 years of childhood deaths, and it's it's between 9,000 and 9,500 childhood deaths every year in America.
Yeah.
So we're fortunate and blessed that our childhood deaths have decreased substantially with increased health, nutrition, sanitation. But just to put it into perspective, about 10,000 children die every year
in the United States
from one of those 10 reasons that so not too many. And we don't want to downplay any of
those children. Here. No, of course not.
Somebody dies, every life matters. So we don't want to talk about it like we don't care, like these aren't real people. They absolutely are. So
but we think it's important to understand, when there's just the headline of COVID being the 6th leading cause of death, what is the context of that, and how do we with our providers make decisions in the best interests of our children with that information. So again, per the CDC, this was updated yesterday on November 3rd, 2021. There are a total of 680 children who have died from COVID. This is over the course of the whole pandemic. 680 children.
From what time period?
So that's from January 2020 to October 30th, 2021.
And that's from zero to 18 years old.
Yes.
680 people have died in that age group.
And they broke it down. The CDC breaks it down. 206 deaths from ages 0 to 4. 474 deaths from ages 5 to 18. And I just want to say a quick disclaimer. I have seen at least 2 different people share that the actual total number of children lost to COVID is 724 instead of 680. Those were shared by people who would not at all exaggerate that number. But the reason I said 680 is because that's what the CDC currently says in their updated data as of yesterday, November 3rd. And then, there's so many different ways to look at data in the age group of 5 to 11. So that's the age group that is now able, under the emergency use authorization, able to receive Pfizer. They make up 8.7% of the entire U.S. population.
Okay.
Of all deaths from COVID in the United States, they make up 0.03% of all U.S. deaths from COVID. So 8.7% of our whole population, 0.03% of all U.S. deaths from or with COVID. Another interesting thing reported by the CDC and also by the World Health Organization is that In all children less than 18 years of age, they make up 22.3% of the whole US population, and they make up 0.1% of all US deaths from or with COVID. So that is a case fatality rate for all children ages 0 to 18 of 0.01%. So case fatality rate of COVID for all children in the US, 0.01%, which is a survival rate for children of 99.99%. I do not say that to make light of the number of children who have died from COVID.
No.
At all.
And we should note that we don't have additional data that would show how many of those fatalities, how many of those children had some sort of pre-existing.
We have a little bit. I mean, we can go
comorbidity.
into that
Okay.
in a little bit later. We do have a little bit of data.
Just to
on that.
see, producer John asked how many 0 to 18-year-olds died from the flu in 2019.
Oh, I've posted that on social media. I should have gotten that for today. We can find it.
We'll follow up with
It's
that.
a great question. And then just again to give, because I think it's important to have this information rather than just a headline out of context. We have lost a total of 751,000 Americans to COVID.
Mm-hmm.
So 751,000 deaths from COVID, from or with COVID in the United States. Again, 680 of those were children, ages 0 to 18. And then just to give some idea, people 75 years and older have made up thus far 395,000 of those. 169,000 of those are people ages 65 to 74. And then the number of deaths goes down with the age group. And again, the lowest number proportionally is 680 children in the course of the whole pandemic. So over 20 months. Some other, we've kind of covered that. I'm just trying to decide what information is most pertinent. So there are a couple of things that I think are really important. Are all kids at equal risk? Amy, yes, absolutely. From or with COVID is such an important difference. And we'll talk about that in a minute. So yes, are all kids at equal risk? Are children and adults, are they dying from COVID? Are they dying with COVID? I personally, Tony maybe disagrees, you know this, I think there's a little bit of, yes, it is difficult to know, but I think there's a little bit of exaggeration maybe on both sides, for lack of a better way to say it. So we'll get into that. I do just want to say, so there's an external scientific advisory committee to the FDA, and they are the ones who voted in favor of Pfizer for children 5 to 11 years old. Some interesting things they discussed in their approval via the emergency use authorization. They discussed how the Delta variant is causing an increase of kids being infected. This is absolutely true. What's interesting is that the American Academy of Pediatrics, the AAP, clearly says that it's very easy to find that data, that more children have become infected with COVID since the Delta variant has been here. However, the AAP is also very clear that severe disease from the virus has not increased. So while the number of cases among children have clearly increased, the number of severe disease has not. And that's from the AAP.
Is that decreased or is it stayed the same?
I don't think it's decreased,
okay.
no. Well, I mean, like I was saying, it has decreased when we were talking at the very beginning.
In the
about
sheer number
the
of
cause
cases, it's going down.
No,
Okay.
cases are going up.
Okay.
That's what no, cases are definitely going up. The Delta variant, from everything I've looked at, has shown that number of children being infected with COVID is definitely going up. But severe infection, severe disease, I should say, not infection, has not gone up. In fact, like we said at the beginning, under all of the data that's leading to this headline of COVID being the 6th leading cause of death, that was the case in January, August, and September of this year. It has illness has consistently gone down since then among children. So another thing from this advisory committee, they talk about the number of children who have been hospitalized with COVID, which is very important. Of course, death is not the only factor we should be considering. So 8,300 kids ages 5 to 11 have been hospitalized with COVID. That, according to the World Health Organization, the hospitalization rate for children with COVID is 0.8%. So again, the death rate is 0.01% to 0.03%, depending on your age. But for children, it's 0.01% to 0.03%. A survival rate of 99.9, but a hospitalization rate of 0.8%.
Which we were talking when we were going over these numbers earlier. I think that number needs more explanation, which we can't offer. Where did you get that stat from with the 0.8%?
That's from the World Health Organization.
Because it's not clear whether that's saying out of every, because 0.8% is virtually, we'll just call it 1% rounded up. So for every 100 infection cases, of children, is there one hospitalization? Or is it out of every 100 hospitalizations of children, is 1% of those COVID positive? And there's been reports, which is one of the reasons why we're doing this. And we're not going to come up with the clear answers, but with one of the problems with public health and with COVID in particular is that you can spin these numbers to make them look any which way that you want.
Yeah.
We've seen that play out with cases. We've seen that play out with death certificates, cause of death, and even hospitalizations. We've heard reports of, hospitalizations occurring from a broken arm, for instance. And if they test that person,
I don't know you'd be hospitalized for that, but
you go to the emergency room.
Okay.
You go to the emergency room for a broken arm, and they test you for COVID. If you test for positive, does that count as a hospitalization? Or if you're in there for cancer treatment and you test positive, does that count?
Sure.
And there's been reports that perhaps that's the case.
Yeah.
Which is one of the problems with going through these numbers is we don't know for sure.
Right. It is correct. It's just an ER visit's not a hospitalization, and we shouldn't conflate.
No, but an ER visit can turn into a hospitalization. That's sometimes how it goes. But
sure. Probably not for a broken arm. I just don't want to conflate.
Not for a broken arm, unless it's a compound fracture.
Okay. Yes. So
we said we like going live before we were doing when we were doing the podcast. We would record it and stop, be like, "That's not perfect."
Yeah,
or we'd fight behind the scenes, and we're like, live actually works a lot better because I'm like, just challenge me if I'm wrong.
Everyone
just tell me I'm wrong. You don't have to be embarrassed if I'm wrong.
See your snarky
just
wife.
tell me I'm wrong, and we'll figure it out.
Yes.
So the other reason why this live time works out for us, the 9:30, is our kids get to bed early.
Yes.
We've been getting them to bed earlier than what we have. So
the AAP has been clear. More children have contracted COVID with the Delta variant, which is exactly what all of the epidemiologists who approved Pfizer for children ages 5 to 11 have said. That is true. But again, the AAP has said from July to October, the hospitalization rate for children with COVID has decreased from 0.9% to 0.8%. You're absolutely right that all of the confounding factors and exactly what's going on and exactly what that means is a good discussion point, but it's still very good to know the hospitalization rate is not decreasing even as infections with COVID among children are increasing. And I think that's important to know. So another thing that this external scientific advisory committee to the FDA has said is that 30% of the children, so across the U.S. in the entire pandemic, 8,300 children have been hospitalized with COVID. 30% of them have no underlying condition. So if that's the case, then those children are presumably being hospitalized just with COVID. However, it could be some crazy, an awful car accident that causes a hospital stay, and then they test for COVID and they happen to be COVID positive. But still, 30% of those children do not have an underlying condition. And then that 1/3 of those 8,300 children hospitalized across the U.S. go to the ICU. The other thing, so I think we've gone through death rate pretty well. It's very valid and important to remember that death is not the only potential consideration with the virus. So this advisory committee to the FDA, as well as obviously the World Health Organization and the CDC, have talked quite a bit about multi-system inflammatory syndrome in children. So I'm sure everyone has seen that. The MIS.
What are the symptoms of that?
So that's it's an inflammatory process that affects many organs.
Is that what was coming out with the rashes and the blotches?
Yes.
Okay.
Yes. So sometimes I think it can be very mild. I think this is my understanding. I might be wrong about this. I think sometimes that is, hi, Sarah. I'm so glad you're here. I think sometimes that can be a mild case at home, but then it could lead to so much inflammation in your kidneys, in your heart, in your lungs, anywhere that it could cause severe multi-system problems within the hospital. So according to this external scientific advisory committee to the FDA, they said that across the US, as of last month, October 4th, 2021, so across the whole pandemic, 5,217 children, 502,017 cases of this multi-system inflammatory syndrome. 60 to 70% of these 5,200 children who had this had to go to the ICU.
Okay.
And then 1 to 2% of those children died.
And are they still seeing this condition, or is this not as much with the Delta, or they didn't say?
I don't know.
Okay.
Well, I mean, I think we sort of answered. So 1 to 2% of those children died. That's part of the number, the deaths of children from COVID that we already talked about. And we know from the AAP that hospitalizations have decreased. That doesn't necessarily mean that cases of multi-system inflammatory syndrome have decreased necessarily, but hopefully we know that hospitalizations, at least
Thank you, Megan.
from COVID,
Wonderful to hear from you too.
Hey, Megan. I'm so glad you're here. So, again, we talked about where COVID is in terms of cause of death for children and how that relates to other causes of death for children. Yes. So another problem is long COVID, which
came up in the hearing
advisory
today.
Committee to the FDA addressed. They said that long COVID occurs in 7 to 8% of kids who are infected with COVID. They defined it. It is for more than 4 weeks. These children experience fatigue, headaches, insomnia, trouble concentrating, muscle and joint pain, or cough.
Hey, that sounds like my life every day.
That might be needed.
Anyway,
you need to
those are serious, but I wouldn't say extremely alarming. I mean, it doesn't sound like there's anything in terms of long-term damage that we know about in children.
Not anyways. That they are specifically talking about. And I'm sure a lot of that is because we don't have long-term data. Right. And I mean, this is my bias with if you're putting Moderna or Pfizer into your body, or if you're becoming infected with COVID, there is a lot of unknown. We don't know. Right now, I don't have long COVID. Maybe I will have some symptom that shows up in 10 years. Because of having COVID now. So now I feel great and I'm grateful for immunity without severe illness. Maybe there'll be a long-term effect. That's certainly reality. I recognize that. One interesting thing when we're discussing Moderna and Pfizer that I would love, if anyone has any actual data on this, I would love to see. I have never seen from the manufacturers, I've never seen them claim, and I've never seen data showing that Moderna, Pfizer, or J&J prevent long COVID. So everything that I've seen, even from the beginning, before anyone had received, well, I suppose people in the trials had received, but before anyone not in the trials received any of these shots, I hadn't seen anything saying that the manufacturers think that their vaccines will prevent long COVID, only that they would prevent severe illness and death.
Well, we should get into the reason why, at least initially, they were pushing the vaccine on us and this is what I would imagine one of the reasons why they're promoting the children is to prevent spread, to prevent transmission from children to adults.
Yep.
I've seen it on Twitter. I've seen it on Facebook, and I've even talked to it. But I've seen grandparents and parents. They were celebrating, especially grandparents, they were celebrating after the approval was made by the CDC and FDA, and they were saying, "Finally, I can vaccinate my grandkids." And but is there I know that when it first came out, that was the reason we were told to get the vaccine, that we would be able to permanently eradicate COVID and prevent the spread. But in just looking at the data, what do we see? Does the Moderna or the Pfizer prevent transmission? Is a child protecting their grandparents by getting it?
I will try to not get emotional about this.
And not make a judgment about it, just the facts.
Yeah, absolutely. Absolutely. So my first thoughts on all of this, and not thoughts, just on my own, but from looking into data, was looking at Moderna and Pfizer and what they presented in writing to the FDA. And what they presented was that their product would prevent severe illness and death from SARS-CoV-2. They never claimed that it was.
So this is from their own
yes,
studies,
yes.
own research.
There was nothing about lack of infection or preventing infection or preventing transmission to others. Certainly, if you can become infected, then someone who is double or triple vaccinated can pass it to someone who is double or triple vaccinated. And that should have been really clear and made clear to all of us. And this is where I try to not, and none of this means that I don't think anybody should choose to get one of these products, whether or not you already have antibodies. But I am beyond frustrated with Dr. Walensky from the CDC and Dr. Fauci from the FDA, because if I knew this just from reading what the vaccine manufacturers provided to the FDA, they certainly would have known this. And the fact that they chose, yes, absolutely. And the fact that they chose to provide this false sense of security to everyone, false sense of security and false sense of duty, I would say. And I wish I could understand if people truly think I am absolutely. I just met someone the other day who was like, I'm never giving in the same park. We were at the same park all at the same time. One mom was like, my kids are never getting this. Another mom wanted to get these for her kids that day because they were approved. And she was talking to her pediatrician's office and sad that they didn't yet actually have the doses. And I wasn't, appalled at either of them. What I don't understand and what I'd like to know is, do people truly think I'm not doing this for my child? I'm doing this because if my child has this, they will protect other people? Or I'd like to know that. And I'm sure it's multifaceted for most people who are passionate.
I mean, we've seen it at play. I mean, I think if you're in public health or if you're in public health messaging or if you're in politics, they oftentimes believe that they have a green light to exaggerate what the truth is, to nudge the public, to get them to go where they want to go, because they generally believe that direction's better than going the other direction. Mm-hmm. We saw it with masks. When we were first told that masks didn't work, I remember I had an old painting. I was one of the first people to wear a mask when it first came out. I had an old painting, a 95 mask, and I took a selfie of me with it. And oh man, so somebody just came after me. You're wearing a mask, and there's a healthcare shortage for PPE. And I was like, relax. I'm like,
it's like a visibly dirty mask from him using.
I would gladly donate it if somebody actually wanted it. Which, the hospitals would never use masks, nor would they even use masks that you just donated or gave them. They didn't do that either.
Hi, Lisa. I'm glad you're here.
But that's what I kind of get the feeling, is that if you're in public health, they have a license to exaggerate. And I think they have also taken advantage of what the public's perception of what the definition of what a vaccine is, and almost hoping and praying that it does what we think that they do in our heads. Mm-hmm. I've heard the examples, and we've heard these all multiple times, that, when's the last time you've heard of somebody getting the measles? And it's like, exactly because of that. Or when's the last time you've heard of somebody getting polio? Exactly because of that.
Yeah.
Even though this is a coronavirus, it operates differently, different mechanisms. And historically, we've never, ever been able to eradicate a coronavirus, ever.
Yeah, MMR is a different vaccine than both the flu vaccine and the COVID one. So that's something to know. You can't say just because they have the name vaccine, they all work the exact same way. One interesting thing, again, this external scientific advisory committee to the FDA, I'm almost done talking about them, but I think it's important because these are the people who decided unanimously, with the exception of one person who abstained, right? They decided to approve this for 5 to 11-year-olds under the EUA. And I still think that most of them had good intent. So I think it's good to know what all of their reasons are. And I would say these are the very best reasons to move forward with this, under the direction of a provider who you trust for your children. So they did talk about transmission from kids. What's so interesting is we now, Dr. Rochelle Walensky has clearly said, Bloomberg just released a study, and I will be honest, I haven't read it yet. Typically, I do try to read studies before sharing them, but Bloomberg shared a study showing that a fully vaccinated person is just as likely as an unvaccinated person to spread the virus within their household. It was very clear months ago in Israel and the UK. It's now become even more obvious in other countries.
Ireland has one of the highest vaccination rates. I think they're at 91%, and their hospitalization rates are soaring. Their case numbers are soaring. Singapore, they're having a case-demic right now, although I think their hospitalizations are low. And we definitely don't want to downplay the vaccine because it has shown to work to prevent severe disease progression with COVID-19, especially if you're in that risk category. And, there's certain comorbidities, but I read a study, and this one was on the conservative side, that if you have 2.75 comorbidities and you are infected with COVID, you have a much, much higher chance of becoming hospitalized. So that's why we just want to stress everybody's different. You should talk to your trusted medical advisor, your doctor, and come up with a plan. What's going to happen if you are infected, whether you are vaccinated or not. You should have a game plan, because I think one important factor, and it's just getting glossed over, and tragically we've heard of some people who have lost their lives because they didn't have this knowledge ahead of time. But if you are infected and you're at risk, especially, those first few days are crucial for early intervention, whether you have the vaccination or not. So whether it's monoclonal antibodies or using some sort of alternative method, I think it's very important to have this type of a plan. Megan's got a question for you.
What about other treatment modalities, non-vaccine related? Yeah, and I think that is what you're.
Because the hard part with COVID is if you're at the point where you're in the ICU, it's too late in most cases.
It does. It seems that way. I mean, this is somewhat anecdotal, although, I mean, sadly, I'll never be the same from the last year from seeing that. So I do think that early intervention is really important, whether or not you're vaccinated. I mean, that's been the really hard thing to hear about more and more people who are fully vaccinated who have had to be put on a vent. And I don't know. I mean, it's easy for me, if I'm being honest. While I absolutely respect someone's decision to be vaccinated, I have a lot of bias against Fauci, for example. I don't understand why it is good to give people a false sense of security so that they don't get some early intervention when they test positive despite
it goes back to my nudging theory. They're overselling the benefits, they're minimizing the safety aspect of it, and in an effort to nudge more people to get vaccinated with the intent. I do think their intent is to save lives at the end of the day, but they don't break it down on an individual level, which I think is ultimately their flaw in the messaging too.
Yeah.
Because we are all not the same.
Right.
And it does matter.
Yeah.
You have another question there.
I will maybe talk about New York a little bit. I was going to say, though, Amy said also Hawaii acted the same, super high vax rate, had a big spike in cases and now going down. And hi, Sarah. And that's other Sarah. I'm so glad that you're here.
Hi, Sarah.
And same with, so another thing, I really am almost done, but this scientific advisory committee to the FDA talked about how important it is that we have Pfizer so that children don't have to miss school. And it's interesting when you look at some other countries who did respond to, that's awesome, Sarah, that you have a COVID kit, that other countries who responded to COVID so differently. I think some people think that the virus itself shut down schools, and it did not. That was policies that did that. And I think some people did that with absolutely good intent. But now that we have some hindsight, it's so important that we look at, for example, Sweden versus other places. And I would never compare Sweden to the US as a whole. I know that we're very different countries, very different sizes, but I've seen multiple people on both kind of sides of interpreting this compare Sweden to Michigan and say that that's a good comparison. They handled COVID. Their response to COVID was vastly different in terms of mandates, school closures, business closures, keeping people away from one another. And yet now Sweden is doing so much better. Less childhood death, less deaths in elderly people.
Compared to Michigan. Yes,
compared to Michigan. And they have not had the added harm of keeping children away from things that they need. So I think that's worth noting. And it's interesting that the scientific advisory committee doesn't take any of that into account. They just say we need Pfizer so that kids aren't adversely affected by missing school. Which, of course, there's some point. As we said, over 8,000 children have been hospitalized with COVID, according to them. I will say they didn't source that one very well, so I wonder a little bit. But according to them, 8,000 children over the course of the pandemic, so almost 20 months, have been hospitalized with COVID. So despite the death rate being pretty low, that's a decent number of children being hospitalized. Another, just want to gather my thoughts. Go ahead.
Well, I was just going to say the risk. So the risk factor, going back to calculating as a parent, you have a child, what choices are they going to make? And to me, it's a risk comparison analysis that one needs to make. And it's interesting that the member from the FDA board, what was his quote?
Oh, I think
and this kind of touches on this idea.
Dr. Rubin from the FDA. So this is his exact quote. He said, "We're never going to learn about how safe the vaccine is unless we start giving it. That's just the way it goes," end quote. It's interesting. I have super strong opinions about many things. When I hear this quote, I don't think, oh, that absolutely means nobody should give the vaccine. I think, finally, somebody's speaking truth. Like when I said this all along, people said I was crazy. Like, you're not crazy for saying that. You're also not crazy for looking at the risk of COVID and saying, yeah, I'm going to take the risk of a vaccine that doesn't have known long-term effects yet because of what I know about the virus. I think a parent can choose that. And that's awesome. This comment, people in parentheses, not on this stream, need to face facts. Yeah, we're all going to get it. I think that's true. That's a good question, Megan. I do want to talk about the origin of COVID when there's time. But yeah, that's a reality that shouldn't be ignored. This sort of trend of people saying only that vaccines are safe and effective is not accurate. They are effective in some ways to a degree. Johnson & Johnson went down to 3% effective after just a few months, for example.
And you didn't see people keeling over left and right either who got the J&J shot. They seemed to do all right.
Right, exactly. So yeah, I don't know. There needs to be more.
But yeah, going back to the risk, and this is the interesting part. If you look at our public health messaging or especially politicians, it's 100% safe, not a single risk. But then you go watch TV and some antidepressant medication will go on. And what's the last 15 seconds of these pharmaceutical commercials? Because they have to do this by law. They need to disclose the risks. And it's like suicide, bellyache, heart attack, death.
And death, yeah.
You don't hear that with this. So it's a red flag.
Do you know why you don't hear it with this?
It's because it's under the emergency use and they don't advertise on television. So they don't have to. So things that are done under the emergency use get special exceptions. But it's not advertised on television too.
Okay.
So what were the last points you wanted to bring up?
We did look at some data about what Amy was saying before about all of the deaths in the US among children and what other things they had. Were they dying from COVID or with COVID?
Go over these numbers real quick.
So I could not find any data from the CDC on comorbidities among only children. I found data on comorbidities among people ages 0 to 24 years of age. And so among that age group, 0 to 24, there were 2,129 deaths in the US over the course of the pandemic. 143 of those people also had or also died from intentional and unintentional injury, poisoning, or other adverse events. 464 also had obesity, 188 diabetes, 89 malignant neoplasms, 60 hypertensive diseases, 147 other diseases of the respiratory system, and it goes on. So I think for a number of those cases, it's probably very true that people were hospitalized and eventually died with COVID, but largely perhaps because of these other things. However, and this is what I was alluding to earlier, the one place where I think there is a little bit of exaggeration, maybe on both sides, is also among these 2,100 people ages 0 to 24 who died over the course of the pandemic, 863 had the flu or pneumonia, 626 had respiratory failure, 257 had cardiac arrest, 147 had renal failure. I think those 4 at least likely, or at least potentially, maybe I can't say likely, but potentially were caused by SARS-CoV-2. And so in those cases, I think it would be inaccurate for me to say it wasn't COVID that caused their death, it was pneumonia, because in so many cases, at least of what I've seen, people wouldn't have pneumonia if they hadn't been infected with SARS-CoV-2. So I think those are COVID deaths. And I think we should be, not always, I mean, you push back at this a little bit, but when we talk about it.
It's just an example of another thing we don't know for sure, where we kind of have to speculate and at the end of the day, make our own judgments based off of our own experiences.
Yeah. So I don't know. It's interesting to look at all of that.
But yeah, I think we should go into the origins of the virus and maybe a different episode.
And maybe talk about New York then too. Because some of that does relate. Like, I mean, it was very interesting to work with. So I give the most credit to those who already were working, and then the pandemic hit and they kept working because they didn't get extra pay, like those of us who intentionally signed up, and they were just thrown into it. And they were there on the first day. I went on April 15th. What? I
was just looking at John's
2020, when things were already starting to that's funny. Actually decrease a little bit. The numbers were already decreasing slightly. So I can go into more of that but being able to talk to people who literally were there on day one was very eye-opening. And then just seeing how the use of hydroxychloroquine was handled there, how people's response to Cuomo's statements every day,
venting,
our discussion of where COVID came from, all of that. Just want to see. So yeah, I think talking about the origin of the virus would be a great one, a different time. We don't know the vaccine ingredients. I think there is one ingredient that makes up, Monica might know this, 12% of Moderna and Pfizer that we don't know what it is. So Megan, I think that's true for one ingredient, and I don't know why that's the case. And Amy said, her 93-year-old grandfather with asthma gets pneumonia every single year and it never kills him. Yeah, I mean, and that's a good point. And that's good for him. I will say so many elderly people die from pneumonia, sadly. And we talked with a physician about this in Florida. And
it's the number one cause of death for the immunocompromised.
Yeah, I mean, so it is a common cause of death among elderly people. So, I mean, yeah, you're right.
Which
maybe
brings
it's not
up,
COVID, which is kind of how Tony pushes back on me.
And some people have brought that up. Is COVID really just, a substitute, a harsher version of a newer pneumonia? Because it's still true that the average age of death from COVID, I believe, is 88 years old.
Yeah.
Which far exceeds the average lifespan of an American adult.
Yeah.
So,
yeah. Real quickly about myocarditis and pericarditis.
So what's the difference between the two?
Myocarditis is inflammation of the heart muscle.
Okay.
Pericarditis is inflammation of the pericardium, which is the sac that surrounds the heart muscle.
Okay.
And so this is there's a preprint article. It is not yet peer reviewed. And in this article, it says, we'll share it, especially if it becomes peer reviewed, but it says, I mean, it is looking at data of 12 to 15-year-old boys who do not have any comorbidities. And it looks at them receiving their second mRNA, either Moderna or Pfizer. And their rate of CAE, cardiac adverse event, is 3.7 to 6.1 times higher than their risk of hospitalization from SARS-CoV-2, from the virus itself. And that was as of August 21st, 21. So maybe in the last 2 months that changed. They also looked at boys 16 to 17 years of age, so slightly older, again, who don't have comorbidities, again, what their rate of cardiac adverse event is after receiving their second mRNA dose. And for them, it was slightly lower, 2.1 to 3.5 times, but still higher than their risk of hospitalization from the virus. So this doesn't mean case closed. No boy who is 12 to 17 should receive Moderna or Pfizer, that they're better off getting SARS-CoV-2 necessarily. There are many things to look into, but I also think that we are at a place where we can't act as if what we're proposing or what they are proposing for us is something that brings with it no risk. And I also think we can't exaggerate the virus, because I will say when you just hear COVID is the 6th leading cause of death among children,
it's a scary headline. It's a scary statistic.
Yeah, absolutely. And I mean, our hearts should break for the 680 or perhaps 724 children ages 0 to 18 who died from COVID.
Sure. But we brought up the point too, though, that, if drowning in car accidents, deaths for children exceed significantly the deaths from COVID, then by the same logic, children shouldn't be allowed in cars. We should make all swimming pools illegal.
I mean, we could undo bathtubs. That would be a great thing.
Don't let kids
all kids
swim
take
anymore.
Showers.
But
no
of course,
baths.
that's ridiculous, because in life we make risk analysis, and we do it every single day. Cost benefit and the risk.
Yeah, college athletes losing their scholarships.
And then finally, the last point that we just wanted to put out there for thought is there has been some people who have noticed that there's increase of deaths from excess deaths. You want to explain that a little more?
So per the CDC, and Megan, can you put that in layperson's terms? You said a summary of kind of everything we've talked about, or something in particular, just if you can say. Excess deaths, I do think this is
it's just something to
crazy
to think about or to be aware of anyways. Like there's more people dying, especially in certain demographics.
And I don't have that breakdown right here. We could find it. It's until we have better technology.
Show.
Yeah. But I do know this for sure. Per the CDC as of today. Yeah. And this is the CDC. There were 226,000 excess deaths in 2020. In 2021, thus far, there are 318,000 excess deaths. So
it's almost 100,000.
Almost 100,000 more, and we still.
And we're seeing similar
the end, but we
numbers in Europe
more
and in Australia
of 2021.
too. But without hindsight and more time, we're not going to know, because a lot of these.
Why do you think? Sorry,
we don't know. We're not going to speculate why either. But
I like when you speculate.
It's just something that we need to be aware of.
Yeah.
And these are because we're not going to know a lot of this data in regards to death, like, as we're pointing out. It takes the record keepers a few years to track what's happening a few years ago. So it's not an immediate thing that we're looking at.
Yes, Amy, I think it's excess deaths compared to average.
But it's something to think about. And anecdotally, I know there's been some athletes who have died lately of heart attacks. There's reports that the Pfizer, the Moderna can have speed up cancer if you already have cancer. None of this is proven. It's just things that people need to take into their consciousness so that they can make the best individual decisions for themselves.
Oh, okay. Yeah. How much higher are suicides isn't excellent. I don't have the actual data here. I know that they've risen, and
suicides,
appalling.
They said the amount of liver transplants has significantly increased because they theorize people are drinking more at home. I know obesity is higher now.
Childhood obesity is higher.
The COVID-19 is a real thing, from just being camped out at home, eating too much, stressed out, living in fear. All these things have negative impacts on people's health.
Megan, I'm not ignoring you. I'll come back to that. But interesting about.
I've been seeing that, Sarah. Is he the doctor from the UK? I've been watching him since the very, very beginning. If that's the same guy, Dr. John Campbell from London, I believe he is.
That's interesting. Yeah, that is interesting. I know childhood obesity has risen, and of course it's multifaceted, and we can't say, oh, it's just lockdowns, but it does seem to be something that is not across the whole globe and only in certain countries. And so I think there are things we could have done better for our children. And what's insane is that now we're setting our children up to have a higher risk of hypertension, of diabetes. We're basically putting them at higher risk of everything, including SARS-CoV-2 as they get older, which is crazy. Like, that's what we've done to our children.
And the thing that remains to be seen too is this flu season,
Mhm.
which if you're in the northern states, the Midwest states, we're just starting to enter into flu season.
Mhm.
And because of all the distancing and the shutdowns from last year, there's a potential, because what they saw in Florida was increases in certain viral infections that were dormant for a year.
Like RSV.
Like RSV, but the
Yeah.
flu, we could have a
Yeah.
worse flu season, RSV, and other potential viruses and illnesses that are going to conflate everything.
Yeah.
So that's why we just say, like, if you're, especially the people who are vulnerable, we really have to look out for each other.
Yeah.
This
absolutely.
season, luckily in Florida, we got the lowest case rate in the whole country. Woohoo! Thanks to our governor, DeSantis.
Victoria asked, any info on cardiac deaths in men in 20s to 40s since vax introduction? It's a really good question. I have some data on myocarditis in particular. I don't think I have substantial data. I've seen quite a bit, especially from Germany, on athletes, young male athletes, and I know one female, but a number of young male athletes who were fully vaccinated. And I'm not saying the vaccine caused it, but then who died suddenly from heart attacks. But I should get actual data on it. Mental illness has skyrocketed. Yes. And then Megan, so she was saying, summarize the 3 to 5% piece for boys being at risk for cardiac events. Yeah. So this study, I'll share a link to the study under this
in the comments
text box. Yeah. But it is, I just have to find it in. Okay. So a study on myocarditis and pericarditis in boys, comparing what is young boys' risk. They looked specifically at boys ages 12 to 17 who did not have comorbidities. What is their risk of myocarditis and pericarditis post-vax versus what is their risk of being hospitalized from the virus? Because both the virus and the vaccine can potentially cause myocarditis and pericarditis. So it is an interesting, like you could potentially get it from either of them, particularly it seems like boys, teenagers, and young men. So this study, which again is not yet peer reviewed, was looking at, does the vaccine increase boys' risk of myocarditis? How much does it increase it over their chances of being hospitalized if they get the virus? And this study is saying that it does, that the vaccine itself increases their risk of myocarditis more than their risk of hospitalization from the virus itself.
We love Florida too. And anyone who wants to come move to Naples, I can't say. I mean, we love the people of Minnesota, and there's a lot about Minnesota that we're going to miss. But Naples is a great place, and it's nice and warm here right now. If you love the Four Seasons, you're probably not going to quite get the four seasons, although we haven't been here for a full year. But I have a feeling the seasons are hot, not so hot, and hot. Basically, is how it moves. But we're coming to the end of the hour here. We want to thank everybody for logging in for our third live stream here, and we ask for your help in growing the channel. Like this video, subscribe. If you could share it, we would appreciate that.
The snakes all died.
Any suggestions?
The snakes all died. You can move here.
Any suggestions? When we first got here, did she hear about the snake? Don't tell
Amy. No, because she's not going to want to move here.
The snakes are nice here, I guess.
Apparently.
But, the big ones, they keep the poisonous ones away. And
within an hour of getting here, our boys were like, we saw a huge black snake.
There's a really weird amphibian and lizard population here, though. I've never seen iguanas that look like the ones here.
Yeah, they're kind of great.
But thank you so much, everybody, for tuning in. We appreciate it. We appreciate the support. And thank you for helping us to grow our channel and our show.
Have a good night, everyone.
Thank you. Good night.
Did you see that? That's awesome. You need to come.